Hello, everyone. Welcome to the 20th edition of the UHN Foundation live stream Q&A on COVID-19. We hope you're staying safe and taking care of each other as the Omicron wave of the pandemic subsides. I'm Christian Cote, host of the UHN podcast Behind the Breakthrough, and we're so glad you could join us. And we're grateful to you, our supporters, who've been so generous throughout the pandemic. So a big thank you from the UHN Foundation and all of Team UHN. In today's episode, we get the latest on the Omicron variant, as well as coping strategies to help promote mental wellness. Of course, we'll be taking your questions a little later in the broadcast as well. Here today to answer your questions, we're so pleased to be joined by Dr. Alon Vaisman, UHN infection control physician. Welcome, Dr. Vaisman.
Thank you for having me.
And we have a special guest today, Dr. Susan Abbey, UHN psychiatrist in chief. Welcome, Dr. Abbey.
Hello. Thank you for having me.
Let's start with you, Dr. Vaisman. Ontario hospital admissions and ICU numbers for COVID patients are on the downswing, and we're seeing a loosening of public health restrictions, both very positive developments. But I'm reading where the provincial science table is projecting uncertainty over the next 2 to 4 weeks. Talk to us about what you're hearing or reading in terms of the modeling forecast over that next period of time.
So yes, absolutely. It's very good news that the Omicron wave is subsiding as fast as it came. The only factor right now that's in play that might result in an increase in cases in the near future is the fact that we did open things up on January 31st. So the science table is currently predicting that there might be another wave leading up to the beginning or middle of March because of that opening up. So it's unclear to what extent that wave is going to hit us. There's a lot of variables at play, including the fact that most recently the Omicron wave, it infected a substantial number of Ontarians. So it does suggest that the next wave might not be as severe if many people have recently been infected. The other thing is that a lot of other waves occurred in North America simultaneously without having any specific restrictions. So it's interesting to see whether or not we're going to have the same kind of rebound effect, despite some areas never really having the same restrictions. So whether these actually do anything is a big question in this specific context. So it still remains to be seen how bad it might be in the near future in about March.
So almost 2 years into the pandemic, everyone has clearly had it, including us here on the panel, with the restrictions and the waves. You hear a lot of the conversation shifting towards we need to recalibrate our approach to the virus. We need to learn to live with it. What's your take on that narrative?
Yeah, I think it all depends on what we mean specifically when we say live with the virus. And I think this probably means somewhere in between how things were before the pandemic and the severe lockdowns in March 2020. What that means is we're going to have do something in the middle of that to try to control the virus, but still allow for kind of normal pre-pandemic activity to occur. So one of those things might be, for example, masking in public during, let's say, winter season. But it won't mean, let's say, shutting down schools for prolonged periods of time. So it's going to be a variety of those kinds of interventions, as few as possible, to live with the virus, yes, be able to do a lot of activity, but on the other hand, still do a few things to try to prevent overwhelming surges to protect the hospitals.
So trying to tiptoe that line so that, again, we don't have the restrictions that we've had in the past, where would a strategy like that leave kids under 5, the immune compromised, and the elderly?
So it's true that there are certain individuals that remain high risk for developing severe disease associated with COVID, primarily the unvaccinated, and along with that is individuals who are elderly and immune compromised. For those individuals, this approach of living with the virus will unfortunately be a little bit more challenging for them. However, it doesn't leave them completely unprotected. We still have masking, which those individuals should continue to do in certain contexts, and vaccination, of course, which protects those people. Similar to how patients who are immune compromised approached flu season every year in previous pre-pandemic waves, that is the approach that those individuals will take in the future. So those measures that they can do for themselves on top of other measures, which, as I mentioned, will probably still be in place in the public, but to a lesser extent, such as distancing and masking, will still to some extent protect those people. It's just a question of how much and how frequently we leave those things in place. But I don't think those individuals who are immune compromised should anticipate we're going to have the very significant kind of lockdowns we've had in the past for a variety of reasons.
However, there's a caveat, right? If we've learned anything in these almost 2 years, it's that this coronavirus is very smart, it's very resilient, and it's not going away. So it's led some public health experts to resist that notion of, let's learn to live with it, because they say we abandon public health mitigation measures at our peril. What's your take on that sense?
So it's true that there's always a risk associated with dropping things. We do see other countries taking the same approach in jurisdictions in the United States, in Denmark, in Netherlands, in Scandinavia, in the UK, many other like-minded countries, with public healthcare access, those kinds of things. Very similar countries are taking the same approach of quote unquote living with the virus. And while it's true that there could be a new variant that arises that results in another wave, another overwhelming number of cases, this overall approach, I think, makes sense for what we know right now about COVID. So it's certainly important, as you said, this virus is very smart, it changes, for us to be always prepared. But I think if this is the circumstances that we're facing right now, makes sense as an approach going forward for the next few months. Certainly, I think we all need to be nimble and understand that if there's a new variant with higher virulence, higher transmission, this might change. But so far, the deaths have continued to come down with each successive wave, which is a reassuring feature.
So our vaccination rate, though, is sort of plateauing. It would appear it's under 90% in Ontario in terms of being double vaxxed. The virus continues to mutate and spread. Do we see more waves coming in 2022?
So certainly there could be another wave, as we discussed very quickly within February and March, again, because we might face more transmissible variants, or because simply we've lifted the lockdowns. One other feature that we mentioned in the last foundation discussion is that there is not a new variant, but a variant that came along with Omicron called BA2 that is different from the BA1, which was the predominant one we saw here. It's about 5 to 10% of the variants here in Ontario. And that looks so far to be like a more transmissible variant compared to the other one, but not any more virulent, not causing more hospitalization or death as far as we know now. So yes, we certainly could see waves again in this year. The big question, though, is are we going to see more deaths associated with it? So far, the answer appears to be no. Even the ICU numbers this wave were lower than the ICU numbers in spring 2021, and the deaths certainly were not nearly as high. So that is reassuring information going forward. The other really challenging aspect to the wave in January was the personnel loss, that this wave was marked by very, very significant loss of personnel on the healthcare front and many, many other places. This essentially like teachers, fire, police, everything you could think of, there was a significant personnel loss. So if we're going to continue facing waves, and if the disease continues to be mild in the same way, milder, I should say, we may need to have a different approach to avoid that kind of personnel loss that we suffered in January.
Well, actually, you've led into my next question, which is we still have a very fragile healthcare ecosystem in this province, if not across the country. How will more waves affect that ecosystem?
Yeah, one of the really big things that is kind of coming out now is the fact that every successive wave, we just had a very reactive response to how we're dealing with it. The fact that we have chronic shortages of staff, shortages of patient beds, shortages of access to outpatient care. It's really just the the can is getting kicked down the road, really. And every time a wave shows up, all the provinces, they react, they shut down, the wave comes over us, people suffer, and then it's gone. But really, we need to think about this in the long term right now. It's a very, very challenging question, but we need to think about sustainable solutions, which means training more individuals, which means building more hospitals, quite frankly, which means getting more people to avoid acute care altogether. So all these models of care need to be developed. And now that we have a little bit of quiet time, hopefully during the spring and summer of 22, hopefully governments across Canada, the federal government and all the provincial governments are thinking about how we make this sustainable, because yes, certainly waves can show up. We just can't have the same cycle of restrictions over and over to solve the problem. We need something more sustainable than that.
All right, a good time to bring in UHN psychiatrist in chief, Susan Abbey, because the prospect of future waves, Susan, I'm sure is disheartening to everyone. Yes, people are exhausted. What do you and your team advocate to help people navigate this endless march of waves and restrictions that keep coming at us?
I do not have a single brilliant answer for you, Christian. I think it's really hard. I think we have to try to take a breath, focus on that things are going to get better. It's going to be longer than we thought, but we're going to get through this. And I often say to people jokingly, but not so jokingly, whoever's in your group, as long as one of you isn't crying, it'll get everybody through, so some days I'm really down with it. Other days, my admin's down with it, or the nurse that I do a lot of work with. But, most of the time, I think just trying to put one foot ahead of another and just try to keep moving forward, and know that, and also to kind of think back to, I like to also think back to where we were, like, in some ways things are so much better than, when I was like scared to touch anything, and I was like obsessively like having to wash all my groceries, right? So that's better. But I think it is really hard for people. It's really hard.
You've been on the front line, Susan, our healthcare workers, yourself, treating patients, saving lives every day of the pandemic. What's your sense of how your colleagues on the front lines are coping?
So again, I think it's very up and down. I think in some ways this is challenging because people are tired. Many people, if they could take early retirement, they've gone. Some people pushed off retirement because they thought, oh, well, this will all be done in 3 months or 6 months, and they're going now. Some folks are going, some of the nurses are going off to lucrative contracts in the States. So I think, and particularly this wave has been really hard because, as Alon said quite elegantly, like he talked about personnel issues, but really there were like, massive numbers of people calling in sick. I was on the weekend before Christmas, and I sort of spent the weekend going around to different wards, and no matter what time of day I was there, people were on the phone saying, could you please come in tonight? Could you please come in tonight? We've got our, dear nurse managers coming in and working like as in charge on nights. Often I have our senior leadership people are going home so that to sleep during the day because they realize they need coverage for tonight. People have been wonderful in stepping up. There's a great story on the corporate internet this week about one of the hospital lawyers who has been working as a clinical assistant on one of the floors, doing stuff that doesn't need clinical care. My own psychiatry group are helping as nurse extenders in the ICUs. It has been, and it's interesting because I don't think that view has gotten out to the public in the same way. People have sort of seen this as, everybody says, oh, Omicron's like mild, so everything's okay. And no, it has not been okay.
Certainly speaks to the team approach. I have to say at UHN that people are pitching in, redeploying.
It's so wonderful, right? It's just so wonderful.
Throughout the pandemic, I know you're in some ways pleased, or the silver lining here is that the pandemic has helped raise the profile of mental wellness. And a word we hear a lot is resiliency, almost maybe to the point of overuse, but it's that we hear how vital it is to coping through difficult times. And I've often wondered, well, how do you get this gem of mental wellness called resiliency? And then I came across this passage from Maya Angelou, which I would love to read you for your take. She says, quote, "I'm not sure if resilience is ever achieved alone. Experience allows us to learn from example. But if we have someone who loves us, I don't mean who indulges us, but who loves us enough to be on our side, then it's easier to grow resilience, to grow belief in self, to grow self-esteem. And it's self-esteem that allows a person to stand up," unquote. Yeah. What's your take on resiliency and how we get it?
Well, it's so interesting because probably when I started in the field, there was this notion that there were people who kind of came out of the womb resilient, and then there were the others who didn't. And now people see it much more like as a muscle that you can, build. I think one of the troubles is, so, hopefully that's going to be one of the silver linings out of this cloud, is that we're all going to have built our resiliency, although it, goes up and down. But I think the things that really help are like taking action. So I read a great quote on Facebook, which is like something like, if you can't wash all the dishes, wash one of them. If you can't, do one of them. Like, just doing something is better than doing nothing. So I think that's really important. Reminding ourselves that things change. It's going to be easier to cope with when it's summertime and we can be outside, and so that's coming, and the days are getting longer. So I think that's really helpful. I think avoiding personalizing it, because I hear a lot of people talk about it. It almost feels like like Omicron came specifically for me, because I wanted to go away at
Interesting.
the holiday season or something. It came, it wasn't just for you. So I think that can help. And I think really the two other things I think are really helpful are kind of gratitude practices, which I've talked about, which sound really goofy to people, but there's like a big scientific evidence that supports them. Just thinking at the end of the day, what are 3 things I'm grateful for? And they can be like tiny little things, like my Tim's steep tea was really good this afternoon. I really like wearing this scarf. There's something small like that can be really helpful. And the other thing that I think can be really, really helpful is just trying to get out into some nature. I don't know if you've heard the expression, people are now talking about nature bathing or, nature meditation, but just, just having a walk where there's some trees or something I think can be helpful, and knowing that it's going to go up and down. And the last thing I just suggest is really saying to yourself, what do I need right now? Because sometimes what we read right now to boost our resiliency is like a good night's sleep, or to be hydrated, or to get up and walk around, or so there's like simple things that we can do for ourselves that help.
Wise words. Thank you. Back to you, Alam, for a second. I understand spread of the BA2 variant you mentioned, which is a variant of the Omicron variant, is on the rise in Asia and Europe, and scientists believe it is more contagious than the common form of Omicron. What's the modeling, or what are you reading in terms of the likelihood of it spreading in Ontario?
Yeah, if we follow the same pattern of those other countries around the world, then it's likely that that will take over as the dominant strain here as well, because it is outcompeting the BA1, which is the previous Omicron variant. But currently it's at low numbers, so only single digits in most labs across Ontario, maybe a little bit more in some areas. So what this means for Ontario is that there could be another surge, but so far there isn't evidence that it is more virulent, that is causing more death or more hospitalization compared to the previous one. And a big question that I think a lot of people are asking is, if I recently had one strain of Omicron, can I get another strain of Omicron? So this will be kind of answered very soon. We know that Omicron has a higher rate of reinfection among people who had previous strains. So is that true for BA1 and BA2? That's going to be very important. If the answer is that there is a high rate of infection, then come February and March, it's going to be a much tougher time, but that remains to be seen.
And last month, when you and I were talking on the live stream, we mentioned a new treatment, the Pfizer drug Paxlovid. Since then, some information has come out that kind of maybe limits its effectiveness or its reach in terms of you need a PCR test before, which is they're not readily available, and there's a very narrow window for treatment. I'm just curious what else you've heard about Paxlovid.
Yeah, there's a few limitations. Firstly, we actually don't have any peer-reviewed data about Paxlovid. It just came from Pfizer. We don't actually have concrete data on it. The second is we only have very few doses in Ontario and across Canada to actually provide patients. The third is that the models of care currently set up in Ontario are not really well designed for outpatient care. So for example, with flu, we don't generally test for flu, but if you suspect you have flu, you can get Tamiflu. It's a very easy drug. You give it as an outpatient for a small subset of people. But with COVID, because we don't have access to outpatient testing, and the CACs, the assessment centers, are not well hooked up with the drugs part, the therapeutics part, we don't have a very easy way of connecting people who are qualified to get Paxlovid with actually giving them the drug. So they need to be tested promptly. Some patients will need to have blood work done to check that they can actually get the drug. They need to have their medications reviewed so there aren't any drug interactions. And they need to get access to drug within a very short time span. So if really what it calls for is a change to the models of care here to try to adjust our CACs to grant or to allow this drug, or even through pharmacies in the future. Hopefully that would be one other way to do it.
Back to you, Dr. Abbey, in terms of treatment tools available to you and your team for addressing mental wellness, especially during the pandemic. I imagine those strategies have been put to the test these last couple of years. Is there any trend in terms of what has helped or worked best for you people?
I think lots of different things. I think the biggest change has been so much of our work is done virtually. It used to be I was on the screen like this with somebody once a week. Now I'm like, all day long. So I think that has been helpful for many people. we also have to recognize that that's problematic for the more marginalized members of society who may not have the technology. And it's also an issue for some people that just don't have the privacy. They can't kind of get the privacy to talk. Probably more people coming in wanting tune-ups of their medication so that, they had been doing well on something, and now with all of this unrelenting stress, they need it like fine-tuned a little bit. So I think that's been helpful. For a while, we weren't able to do any group kinds of treatments, but now we've worked out how we can do that sort of safely over virtual care and maintaining patient privacy and all of those things. So that's been helpful.
And what about for young people? Because this is affecting them equally, children and teens. Has that cohort presented new or specialized demands?
It's interesting. The biggest, I think that there have been more kids, I think more kids being concerned and more parents being concerned about them. So it is really, challenging to hook up with resources. The one thing that we know clearly has really worsened is eating disorders, and particularly young adolescents, sort of up to, early 20s, mostly women, but sometimes young men. The numbers have just like gone through the roof. I think it's like they said a 300% increase in the child and adolescent space, and probably like 100 to 200% increase in the adult space. So that's been a big challenge.
And is there sort of maybe a central place that people could go for consultation or at least information on the UHN website?
So there's some on the UHN website, and I think I was talking with the foundation staff. We'll put something in when we mail this out to people.
Fantastic.
So one of the good things is that I think that the provincial government has responded by making readily accessible a number of services through psychologists, but virtual services and online services. So that's really helpful. The crisis services have increased. And then, we're getting some new services thanks to some donors to the foundation. We've been able to develop an online e-health intervention to help people with depression and anxiety and trauma related to COVID. So we've just pilot tested that and had good results, and are bringing that out. So there are some good things.
Yeah, and I'm curious about your colleagues, healthcare workers on the front lines. What are you and your team like? What are the demands you're seeing from you and your team from that group?
So again, thanks to some wonderful donors, we were able to establish something called UHN Cares, which is coping and resiliency for employees and staff. And so we've had UHN Cares, and it's like a multi-pronged kind of thing. We've got self-management resources that people are able to use on their own. And we've probably had about 12,000 hits there. We've got one-on-one, either with psychiatry or psychology or both. Maybe some people need both. And that's been quite helpful for people. And we've got a thing called Team Cares, and we go out to the units and sort of try to make ourselves available to be helpful to people, to give them other resources. Our latest is that we've been buying, people like treats. Healthcare workers really like treats. So we've got a well-stocked little cart that we go out with, and that gets us in the door often, and then can have good discussions. I mean, the other thing that donors should know, because I know that this is for the foundation, it's been really helpful. The foundation has been huge in sort of giving things out at various points to really help. So I just spent last weekend signing off all the meal cards for people, and I can't tell you how happy people are, like with their free salad or hamburger. Like it's, because it really means they feel like they've been heard, and somebody cares about them. It used to be everybody was out banging the pots, and now
not so much. No,
not so much, and people are tired and working hard and want to get back to doing what they like to do, and also I think really struggling to feeling sorry for people who are sick at this juncture, and it's hard.
Dr. Vaisman, what are you hearing in terms of the latest recommendations on a fourth dose of the vaccine for the virus?
So as of January 13th, Ontario Health released a document recommending which, I mean, it was established before, but they updated the recommendations about receiving fourth doses. This is primarily for the group of individuals who are living in congregate settings. So for example, long-term care or retirement homes or other congregate areas. The evidence to support giving a fourth dose is quite limited. There are some countries in the world like Israel that have given it more broadly. Here in Ontario, it's just limited to that group. It's really the theoretical risk that after receiving a primary series of 3 doses that people will have a waning immunity, and the fourth dose provides a boost for those people. So it has been rolled out already. It's been already, the vast majority of long-term care facilities already received it long ago. So there isn't really much movement on that in terms of the general population receiving a fourth dose. And I would imagine that it would be some time before that happens. We really haven't gotten nearly the good numbers we want for third doses even. So it's going to take a while before fourth doses before the science shows that fourth doses are necessary for the general population.
Okay. But still, bottom line, we know vaccines remain the best way to keep everyone safe. They protect us from getting COVID. And if you do get COVID, they blunt the symptoms. I'm wondering if you think a vaccine mandate would get us over the finish line here in terms of providing Canadians protection and at the same time preserve the capacity of the healthcare system to manage future waves without restrictions.
Yeah, vaccine mandates are a tricky thing because when you think about vaccination, it's a medical decision that's personal to you. And one of the primary pillars of bioethics is autonomy. We want people to make decisions about their medical care without any undue influence or coercion. So certainly a mandate is coercive to people to get vaccinated. So we must have a good reason to coerce people to get vaccinated. So for example, a healthcare worker, a teacher, somebody working in a long-term care facility, in my mind, the coercion is balanced out by the fact that you're protecting those individuals. So vaccine mandates make sense to me there. But as a general, for the general population, had just kind of a blanket mandate, it'll increase the numbers, but I wonder whether there'll be significant backlash, and I wonder about the ethics about it as well. So I would say overall, the Canadian situation is extremely good. We are certainly in the top 10 of all countries in the world in terms of our vaccination numbers. Getting that last percentage of people vaccinated is going to be very challenging, of course, but I'm not sure a blanket mandate for everyone in the population is going to be very practical, or result in significant backlash.
Vaccine inequity remains a huge issue also, and I'm talking more of the worldwide picture, and because my understanding is almost half the world's citizens have not had 1 dose of the vaccine. I'm just curious from your point of view, how much of a factor is that inequity in how we get to an endemic stage of the virus?
Yeah, first of all, the primary thinking here is that we need to give vaccines to everyone because it's the right thing to do. Bottom line, people need vaccines. It's just like giving any medication or any medical care. Everyone in the world should have access to it, bottom line. But if you just think about it strictly from like a selfish point of view, me as a Canadian, how is it important for other people to get vaccinated? If you just focus on that, then you just have to recognize that the virus will mutate more frequently the more times that people are infected by it. That's really the bottom line. If you have 1 billion people infected by it, there's that much more chance that somebody will have a mutation and result in a new variant. So the more people you have vaccinated, the less viral burden across the globe, the less likely that occurs. Just also from the perspective of traveling to other places or those individuals traveling here, we don't want people transmitting virus in general. So of course that reduces that as well. This may have not mattered 100 years ago, but now because we have such an integrated society across the world, plane travel is so integrated, then this becomes more of an issue for everyone across the world to be able to be vaccinated and to protect each other.
Dr. Abby, final word to you before we turn to our audience questions. I was speaking recently with a UHN emergency physician, Dr. David Carr. He mentioned he's observed a shift in societal attitudes and support for healthcare workers. You mentioned, there was the banging of the pots early on in the pandemic. There was great support, it seemed, or an outpouring of support for healthcare workers. Now, not so much. He mentioned that when he gets online abuse when he goes on and supports vaccination. And we know last week during the trucker convoy, some of our staff needed police protection to get to work. What's your sense of how this is hitting frontline staff at UHN?
It's really hitting people. My daughter's a nursing student, and she was on a shift last weekend. One of her coworkers had their mask ripped off and were pushed to the ground on Friday night. Like, it's just unbelievable for people. I think it's one of the things that's most challenging. And I mean, I also see a lot of this online abuse, and it's very hard for people. It's very hard for people. So I think the leadership of the hospital is spending a lot of time going around and just saying to people, thank you, you know, like, you really are doing incredibly difficult work at an incredibly hard time, and it's valued and it's important. But but I think people find it so frustrating, because they just feel like, if, you know, if everybody would just get on the same page and move forward, you know, we could do a lot better. But,
well, and I have to say to both of you, a pat on the back to the both of you for what you do every day. It's really much appreciated. I'm wondering, and either one of you weigh in here, or both of you, what can we in the audience here do for you guys?
I don't know, to me, I think a lot of just really saying thank you to people, you know, like, and just as simple, like at the end of an appointment saying,
You're muted there, Susan,
sorry.
after
Yeah,
saying
no,
thank you.
no, I was just gonna say, just saying thank you to people. You know, I really try to make it a practice to say thank you as often as I can during the day, because I think it's really important, and for everybody, for the hospital staff, for the people who work in the food court, you know, the cleaners, everybody really just needs thank you.
Alon?
Yeah, I agree with Dr. Abby's comments, and also Dr. Abby highlighted the important contribution that the foundation has made financially to the institution, and I just want to echo that as well, that is concretely a benefit, a huge benefit to everyone. So the contribution specifically from the audience here has been very much appreciated by the frontline staff, and of course myself and my department. And the other, you know, major thing is, you know, I'm not sure how many audience members here are vaccinated. I'm sure it's quite a high proportion, but just listening to public health advice is just that's a really important aspect to all this. I think it's also time for people to understand that the way this pandemic is going to go in the future isn't as much dependent on individual decisions people make, because we have a very high rate of vaccination. The virus has become relatively mild compared to the previous variants, and of course still results in death. But now the way we're going to get out of this is going to be more system solutions, as we discussed earlier. You know, making sure that our hospital system is sustainable and can actually face future threats. So what this audience can do is really think about those things and advocate for those sustainable solutions, is making sure our staff are well supported, making sure, you know, even new hospitals being built. I know that sounds a huge you know, investment, but that is exactly what we need. That is a major limitations we are facing here, is old infrastructure in Ontario. So those kinds of things are things that we really need in the hospital sector.
Yeah, certainly those are questions we can be asking when our politicians come to the front door during the election time.
Exactly.
Right.
I don't think we should underappreciate the value of the populace asking more of their politicians, no matter what party you support, is asking them for a clear plan of what you actually plan to do for the healthcare system in the long term.
We'll leave it there. I want to get to our audience questions. Thank you to you both. We'll do our best to get to as many of them as possible. There they are. First question. It seems to me that the risk of getting COVID now is higher than it's ever been. I'm guessing, I can't see because I got some pictures here. There we go. However, everything is open now and we can go anywhere. Will we all get it eventually? Alon, I'm going to throw that to you.
I think in the long term, yes, there's a very high likelihood that you're going to get this, just like any other respiratory virus. It's just a question of when you will get it. Only because it's likely to become endemic at some point in the future. We don't know when exactly, but it's become so common that it's likely that everyone is going to get it. Even during this last waves, you know, probably 1 million or more people got COVID during this last wave. So that's a huge proportion of Ontarians when you think about it. So the key thing, though, the most important quote I heard regarding this is, you're going to get COVID at some point. You better hope you're vaccinated when you do, because you're less likely to die as a result of getting COVID then. So I think people just need to understand that, still need to adhere to public health measures, still need to protect themselves. But just the reality is that if you're vaccinated, the likelihood of you having a poor outcome is much, much, much lower, regardless of the age you're in.
There's a clip for social media. All right, next question. The disproportionate use of hospital resources by the unvaxxed has led to delayed diagnosis, treatment, surgery, resulting in needless additional suffering and death. What policies can hospitals enact, and what laws that government should enact to correct this situation going forward? Susan, how about I start with you, because there's kind of an ethical question here to kick things off. I think you're muted again, Susan.
I'm not doing well by you today, Christian.
Not at all.
I've got a little bit of a cough, so I've been hanging, but I don't have COVID. I've been putting myself
Good.
off. I know, I was going to say, we had a little bit of discussion just amongst ourselves, but before this, because it's such an interesting question, because I think it's one that a lot of the public ask. I think it's a question that healthcare workers ask. And I think the challenge is, and I think Alon can speak to some of it really well too, is that it's so hard. It's not like there's a magic solution that will make people go out and get vaxxed. And the other part that is really stunning is how many people still don't believe that this is like a real disease and have really deep-seated doubts about the vaccine. How like the kind of lack of scientific literacy is really amazing. So I just really try to be compassionate, right? And then I think the other thing is, once people end up at our door, then our oath and our duty is to take care of you and to take care of you the best we can. And I think what's very challenging for most of the healthcare workers I know is that we also see, we don't just see that sick COVID person, but we see all those folks who have been good and have vaxxed, and they're having their care delayed, and it is very very morally distressing. It's upsetting.
Alon, anything to add?
Yeah, I agree with everything that Dr. Abby mentioned. Just to say that we don't have a lot of control over policies outside of our walls, but certainly at UHN, we do require all our healthcare workers be vaccinated. We do require that our visitors be vaccinated as well. And all the vendors, anyone who comes on site who's not a patient, that we require them to be vaccinated. So at least that bumps up the numbers a little bit, of course. But in terms of the care we provide, it doesn't really come to the point where we have to choose between providing a ICU bed from a vaxxed or unvaxxed patient. It would be very rare if that ever does occur. But I think it's important to recognize that no matter what we do, we provide care for everyone. And why somebody's unvaccinated is a complicated question, just as complicated as other health decisions that people make that lead to their illnesses. So I think, again, Dr. Abby made an excellent point that we need to show compassion regardless.
Next question from Fern. How should seniors be living with COVID today? Specifically, what things should and shouldn't we be doing when we're at home and when we go out? For example, how many people can we safely see at home? Are masks required? Should we give our guests a rapid test? Alon?
So first thing is to always follow the public health guidance of the province and then your local health unit. So in terms of masking, distancing, how many people have in your home, that's always the first thing to follow. And then, yes, the restrictions are going to slowly melt away. We're going to have less and less of that over the next few weeks and perhaps return to that at some point. But that's the first thing I would say. As for what you do with your own, let's say you don't agree that some of these restrictions have been lifted, do I need to, limit the number of people in my house? I think that answer depends on who you are. There are certainly some seniors who are very healthy, who have very few comorbidities, who are living independently, that probably don't need to do much in terms of restricting their activity. And as long as they maintain a low level of adherence and restriction, like wearing masks in public, for example, in closed areas, then I think they'll be fine. But there's some individuals who are very vulnerable, who, let's say, have a cancer or who have recently had a transplant, for example, who are at very high risk of getting COVID, and despite vaccination, having a bad outcome. So I think those individuals might want to be more careful. So perhaps masking more liberally, or perhaps masking even if the mandate is removed at some point. A rapid test may be helpful in some circumstances with large gatherings, for example, or being a little bit extra careful if somebody around you have the sniffles. So this is all on a spectrum. I think you really have to ask yourself and, about the ones, also ask the ones around you who are the loved ones who are also potentially vulnerable, and think about what risk threshold you're willing to take when you do these activities.
And risk threshold, I think, will apply to this next question from Barbara, although I might have you both weigh in. How can I overcome my fear of going into restaurants once again? Even when tables are spaced apart, I am fearful of Omicron spread while eating. Why don't we start with you, Alon, and maybe Susan, if you want to weigh in.
Yeah, I mean, just strictly from the numbers perspective, I think whether or not you have fear associated with restaurant eating, it's reasonable dependent on how many cases of COVID there are. I mean, that's one simple way you can approach the question is if in your local health unit, there's very little or few cases, and let's say you're vaccinated and you're otherwise healthy, then the risk to you is generally low. And even if you do acquire COVID, your personal risk is generally low. And again, I think you have to weigh that according to how much you enjoy restaurants. Some people, it's a critical component of their leisure time. So again, if you just simply look at the numbers, look at the risk in your local area, you will have a little bit better understanding of what the risk is to you.
Susan, anything to add on the fear aspect of this question?
So I was glad that Alon sort of put it in context because I've got fear about doing this. So my answer is I'm not going until like the spring patio season has opened up. And I'd also say, I mean, I think it's like, how important is it to you to go? How important is it to the people in your life that you go? And what other risks are you taking? So like, I've got a dear friend who adores restaurants. So she does restaurants, but she's decided to give up going to get her hair cut and her nails painted because those are other incremental risks. So I think it's challenging. And I think the first time I would go, I'd try to go at an off-peak time, get somebody that you trust to go with you and, stay a shorter period of time.
It's very practical.
Yeah.
Next question. Going forward now, how do I interact and deal with a part of your family who have chosen not to get vaccinated? Again, maybe perhaps that's a behavioral question. You want to start that off then, Susan?
So this is I hear this question more than any other question almost. I mean, I think in some ways at this juncture now, 2 years in, I think we probably have to give up on thinking that we are going to be the ones to talk people into something. Having said that, I must say I've got a patient that I adore who has refused to get vaccinated, and I kind of go around the edges of it, and he's now agreed to go. So, and he got his shot. So
amazing.
So so maybe
the patients.
Maybe you want to, but I think it's getting some sense. Your family, what they're like, and how. Because I think the other thing that's really sad, I think a lot of families are really getting torn apart by this.
Mm-hmm.
Right, and so it's weighing up all of those different bits.
Yeah, and I would just add that again, it all depends on the local prevalence. There's during the summertime, for example, we have very little COVID last year, and we're likely to have very little this year. So simply not being vaccinated does not mean you have COVID. And I think you need to understand the risks again to yourself and other people, and understand that not every kind of exposure is equal. And you could also mitigate the risk by doing things, ventilation, masking yourself, going outside, those kind of things.
Exactly. I've heard that vaccines are being developed that are much broader spectrum than just for spike protein COVID-19 viruses. What is the state of the research on this, and when will these be available 1, 2, etc. years from now? Alon?
Yeah, so they're certainly making modifications based on the new variants, but no data has been released from any of these trials. So we don't actually know what the difference in efficacy might be from a new vaccine compared to the one that we've been using until now. So it's anybody's guess in terms of when they're going to be releasing their data in the next few months about that. The challenge is that we're studying this pandemic in a context where in most countries, there's a highly vaccinated group of people. So it's a little bit harder to recruit people or understand what the difference between a primary series of vaccination versus boosting might be with a new vaccine. So all I can say, or all we know, is that Pfizer and Moderna are currently working on this at the moment. And I would assume that they're still recruiting.
Next question from Lorraine. Decisions on public health and restrictions seem to try and balance safety versus mental health, financial concerns, and what the public will tolerate. What criteria should I be looking at to decide that previous precautions are no longer necessary? Alon?
Well, I think There's certainly certain jurisdictions during this pandemic who've lifted restrictions, and it didn't make any sense because hospitalizations were high, case numbers were high, deaths were high. But if you're dealing with a scenario where case numbers are low and everything is going in the right direction, then certainly lifting restrictions to some extent, depending on which ones, might be helpful or might be safe to do. So I think that, again, I kept saying this, but the context really matters. If you're having, 5 cases a day, that's very different from having 3,000 cases a day. Of course, we don't have the same data available to us because we don't have testing on an outpatient level, but we still have lots of patient case numbers. We still have hospitalization data. We still have death numbers. So all of that can be used for yourself to decide whether the criteria makes sense to you.
Exactly. Next question. Please discuss the different masks, i.e. KN95 versus N95, and how to know whether they are fake ones. According to CNN, there are fake masks, especially the KN95s from China that don't have the proper filtration. Also, please discuss surface contamination and the latest studies in this area.
So regarding the K95s or N95s, certainly there's a lot of counterfeits being produced. It's hard to know which one is reliable and which one isn't. I would say that there has been recently investigative journalism that has been performed on various models. So for example, CDC did a recent investigation, or CTV or Global. You could just Google those and look at the reports that they came up with. And I would say that those news agencies are generally reliable in terms of their investigations. They also sent those masks to be tested by actual accredited testers. So that's one way you can actually look to see whether the masks you're buying are good, is to look at investigations that have been done. As for the surface contamination, we've always known that surface contamination has some degree, some component of transmission. It's generally been thought that it's very low. This might be a little bit different with Omicron because one recent study has shown that it survives a bit better on surfaces than the previous variants. But still, overall, the thinking is that the likelihood of transmission from surfaces is low. That doesn't mean you shouldn't wash your hands. I think it's very simple. It protects against other pathogens, so we should continue doing it, especially during flu season. So, just simply washing your hands when you're in and out of places, touching things, it's still going to be an important part.
How best for grandparents to protect themselves if seeing unvaccinated grandchildren under age of 4 while indoors?
Yeah, so even personally in my family, the way we've approached this question is, again, what are the case numbers like? And when it's extremely high, we just avoid that kind of contact. But if case numbers are coming down as they are now, the simple things you can do if you're feeling very uncertain or anxious about it is to have the grandparents mask, or to meet outside when things are warmer, or to open the windows, make sure that the room is well ventilated. So also do good symptom screening. If your kid has started having symptoms, then it wouldn't be a good idea to meet. Children can transmit COVID for sure, but they're just less likely to, if you're talking about very young children compared to adults, for example. So the risk is lower. It's not zero. They still can transmit to grandparents, of course. But if they're asymptomatic and otherwise well, and the grandparents are masked and the grandparents are vaccinated, then the risk is overall low when case numbers are falling.
From Kathy, what do we know about long COVID for those with 3 vaccines, 2 plus a booster, particularly with respect to older people, 60 plus?
So actually, even with 2 vaccines, a preprint was released about 3 weeks ago showing that the rate of long COVID is essentially at baseline or very, very low if people have had 2 vaccines. And the long COVID syndrome is primarily found in those who are unvaccinated. So many people who got it before the vaccination was out, or people who've gotten it since and not been vaccinated. So if you get vaccinated with 2 doses, and even better with 3, the likelihood of you developing long COVID is extremely low. And this is consistent with other evidence showing that even inflammatory disorders in children are substantially reduced if they get vaccinated. So we know that this kind of fits with what we know about vaccination, is that it's very good at protecting you against severe outcomes, not very good at protecting you against mild or asymptomatic disease. So it still has a very, very powerful effect.
Well, that's a great impetus actually for vaccination again, because my understanding is up to about 10% of people who get COVID get long COVID. So to know that the vaccine reduces the chances of long COVID is certainly a positive. Next question. What are the symptoms of Omicron we should be looking out for? Are people with no symptoms infectious?
So the symptoms of Omicron are very similar to the previous variants, except that loss of smell and taste are less frequently seen with Omicron. But outside of that, cough, shortness of breath, sore throat, sneezing, fever, they're all seen with Omicron, just as they were with previous variants. So, and just with previous variants having no symptoms, you can still be infectious. And that's really the big problem with COVID to begin with. Starting from the very beginning of COVID, that's really the issue, is that even if you in the pre-symptomatic phase, you can give somebody COVID. And so it's important to recognize that when you're thinking about exposures. But again, when case numbers are low, that's less likely that you're going to have it. And if you're fully vaccinated, that's less likely that you're going to be transmitting to anyone as well.
Next question. What's the best way to properly filtrate for COVID personal residents? What kind of filtration units are best? How many units would you need? Is it, one per room, one per floor that's moved from room to room? How long and frequently would you run the units? Any additional comments?
So in personal residences, there's no really specific need to run any kind of advanced filtration. It's just that, first of all, is it anyone in your house who has COVID or transmitted COVID? Second of all, if nobody you suspect could have had it, there's nothing really you need to do differently. You're not going to introduce COVID to your house simply by turning on an air conditioner or a heater, for example, or opening the door. You really to have somebody with a high viral load in your home for there to be a risk to yourself. If that is the case, if somebody in your home had COVID and you found out several hours later, for example, there's nothing really specific you need to do. The COVID is probably long gone. It's settled on surfaces. So there's really not much. If you're worried about somebody coming into your house who might have COVID and the HVAC system in your house, first of all, you could do the standard checking of any HVAC system to make sure it's up to date and change your filters as you would normally. But outside of that, I don't think you need to install HEPA filters, for example. It's really not necessary in the majority of settings, I would say, in personal residences. It's more, I would say those kinds of filtration is more important in congregate settings or in high-risk settings such as schools, perhaps, or in certain high-risk settings in hospitals. But even then, it's questionable, again, how much benefit it provides.
Next question. What can we do to deal with the isolation that this virus is causing, and especially when people live alone? Susan?
Yeah, I think it's challenging, but I think it really is trying to connect with people when you can. I've had lots of friends who have connected with people from earlier in their lives who set up now like Zoom dates. Let's have a glass of wine together. We can do that and be safe. Getting back to things like sending cards and writing letters. Getting out walking and saying hi to the neighbors that you see in the streets. Again, I think people are much less scared than they used to be, where everybody stayed far apart. So I think that some of those things can help, but I do think it is like, it's a common problem that I hear. It's very challenging.
Certainly going to make us value our in-person get-togethers going forward, isn't it?
Isn't it?
Next question. If the REQ for proof of vaccination is lifted, how safe is it for anyone to enjoy their meals in the restaurants, work out in gyms, crowded hair salons, since next to us could be a person unvaccinated, infected with COVID? Is this going to help the economy if people choose to avoid such places?
So again, this goes back to the question, is if there's a lot of COVID in your community. And if there isn't, then it doesn't matter if somebody's unvaccinated or not. There's just a very, very low likelihood of them having COVID. The second thing to recognize is that the vast majority of Ontarians are vaccinated, close to 90% of people. So regardless, just if you take a random sample of people going to a restaurant, 9 out of 10 of them will be vaccinated. So that's really, really important to recognize. I'm talking about the older group, the 18 and above. So you're talking about a low risk to yourself because you're fully vaccinated, I assume. A low risk in the sense that other people in the room are likely to be vaccinated. Again, 9 out of 10 chance. And then also a low risk if there's not much COVID in your community, plus your distance, plus, the place may be well ventilated. So when you add all of these factors together, your overall risk to you is probably going to be very low in most settings. The exceptions would be is if there's a time where COVID numbers are extremely high and restaurants remain open. That would be the one exception. But again, you still have a fairly, several high levels of protection still going in your favor.
Next question, please provide useful apps and websites for mental health assistance, as psychiatrists are not available where I live, and many people cannot afford to pay for counseling services. Susan?
So we will do that. And the one sort of silver lining to the COVID cloud for mental health is that there now are no cost counseling services available. So we will get those to you. We'll
Right,
post
you're
them.
mentioning in the follow-up email after
Send
today's
a
live.
follow-up email afterwards. Yeah, we'll add them
Okay,
there. So we'll
fantastic.
get those for you. But one of them is called Bounce Back. And
Bounce
there's
Back.
Bounce Back, and there's Mind Beacon. And there are a couple of others. So we'll get those to you.
Appreciate it. As vaccine mandates ease, does it make sense to continue to use existing rapid antigen tests? If so, are they effective in detecting Omicron or future emerging variants? Thank you.
So using rapid antigen tests may have a value when you're going to a congregation of many people in one room. And again, if COVID numbers are high. In that setting, you may have value to swab the people who are going to that large meeting. The only problem is that we now know that the rapid antigen tests are not as sensitive at picking up Omicron, which means that if people are symptomatic or asymptomatic, it's not as good at actually picking it up on the test itself. It's maybe 30 to 50% sensitive. So it may add some value, but it's important to recognize that there are limitations. And still the most important screen to do is not the testing, but symptom screening. If you have symptoms, you really shouldn't be going to these large group settings or going out at all. You should be staying home. So that's an important thing to recognize when we're using rapid tests.
Next question from Brian. How long does the rapid antigen test stay positive after infection, and how long is a person contagious?
So if you think about day 0 being the day of your symptoms, a rapid antigen test may be positive 1 or perhaps 2 days before you're symptomatic, and likely to remain positive approximately 4 to 5 days after you're symptomatic. There are cases where people are positive even longer than that. The period where you're infectious is approximately 10 days. That would be a little bit long, but generally speaking, you're infectious 2 days before the onset of symptoms to 10 days after. But with Omicron, that period is actually thought to be much shorter, or shorter than the previous variants, perhaps as short as 6 to 7 days after symptoms.
Next question. In wearing masks for such a long time, breathing in the same air that we are breathing out, does this represent a health hazard in any way? Alon?
So generally speaking, the hazards associated with masks are very, very low. There's no really issue with oxygenation or carbon dioxide exposure. People wear masks for prolonged periods of time without experiencing any significant side effects whatsoever. The only hazard that sometimes people note is with tight-fitting masks, such as N95s, people get dermatitis around the face. We definitely see that in healthcare workers who wear N95s. It's not that common, but it's something you should watch out for if you're wearing a very tight-fitting mask. So the solution there would be to wear still a high-grade, high-quality mask, but it doesn't necessarily need to be that mask, or a mask that is not as tight-fitting, or a different mask that might fit you a little bit better. But no, the breathing issue is not recognized as a problem at all for wearing a mask.
And a speculative question for you, Alon. What impact will the Freedom Convoy and all its mass gatherings without proper protection and protocol have on the spread of COVID-19?
Well, in general, most of these protests are occurring in outdoor settings. Very few are indoors. So the overall likelihood of transmission outdoors is far lower than in indoors. So among those individuals, certainly there could be transmission if they're in close contact with one another in the outdoor setting. But to the general population who's not involved in the protest, for example, it's still quite low unless you're quite close to them or something. You go up to the protesters. There are still vaccine mandates for restaurants, hotels, other things. So they still need to be vaccinated to enter those settings. So it doesn't really pose a risk to those settings, really. It's just to one another if they're very close to one another in the outdoor setting.
Is there a way to measure COVID immunity? It is the case of a UHN patient who takes drugs that depress her immune system. Can we measure how protected she is after her 3rd or 4th dose?
So in a research level, we can test it. If somebody's in a research study, we can test their antibody levels, and sometimes we can test the other branches of the immune system to find out whether they're reacting to COVID. But in a general clinical sense, we don't often do that. We simply rely on you being vaccinated to make sure that you are or presumed to be immune. If you're immune suppressed, there's no doubt that you're going to have a lesser response to the vaccine. But that is the reason why we would provide them a 3rd and then for some individuals a 4th dose. But after that, there isn't really a commonly used clinical test that we use. It's just an assumption that they're protected or to some degree protected.
We have unfortunately come to the end of our time. It's the top of the hour. We must let our people go here. I want to thank everyone in the audience today for joining us, and a big shout out to our guests, Dr. Alon Vaisman, UHN infection control physician, and UHN psychiatrist and psychiatrist in chief, Dr. Susan Abbey. I want to thank you both so much for taking the time out of your busy days to share your insights and expertise. Thanks, Susan and Alon.
Thank you,
for having
Christian,
me.
and thanks to everybody who turned in today.
This live stream will be up on our YouTube page, the UHN Foundation YouTube page and Facebook page, shortly after the broadcast ends. And finally, donor support. If you have dollars that could help, we need the dollars to fuel the groundbreaking research initiatives of our award-winning UHN scientists. So, and they're working hard to improve and make new discoveries when it comes to treatments for patients with COVID. So if you're able to give, we ask you to consider making a donation. Go to www.uhnfoundation, that's all one word, uhnfoundation.ca/help. Thanks for tuning in. We'll be back with another episode next month for the 2-year anniversary of the pandemic. Keep an eye on your email inbox. In the meantime, be kind, mask up, please get vaccinated, and stay safe, everyone.